Well, let me just start off by thanking Martina for the invitation to present and for the presentation thus far. It's been interesting to sort of see the perspectives and nice to hear some optimism from the speakers. So I share my screen and assume that that's working. Obviously, as an urban economist, I think about cities as places where people consume, work, interact with one another. My research focuses on consumption amenities and social amenities. The idea that Ed first introduced of cities as being, consumer cities. Today, when we're thinking about COVID-19 and the future of cities, I'm really going to come at it the question from that perspective, perhaps giving a bit more of a targeted perspective than the broader perspectives that Ed and Diego provided. Really thinking about how has consumption responded to the pandemic, and then what can we learn from these trends in consumption for the future of cities, at least in the near term, when there's still this potential threat of this pandemic. So I'm going to be using for this analysis smartphone movement data. And since this data is really all over the place now, it's being used by sort of economists and public health professionals to think about where people are moving, how the disease is spreading. I'm going to provide a bit of background on the type of data that I've been using with co-authors. So the data we're using is processed by a company called PlaceIQ. PlaceIQ accesses a subscription to pings that are coming from cell phones, the apps that people have on their cell phones. Okay? And this data, this subscription is probably what you're seeing when you're seeing cell phone data or smartphone movement data being used broadly, sort of in the New York Times, etc. It's the same underlying data that, for example, SafeGraph has. So what PlaceIQ does with the data is that they intersect the pings that are coming from devices through their apps with polygons of establishments. And they focus on identifying visits to retail establishments because retailers are their primary customers in normal times as well as today. And then they also identify a lot of visits to residential locations. And sort of these residential visits are complementary in the sense that you can use them to identify where the devices actually live. So you see where someone lives, and then you see all of the retail establishments where they're going to. PlaceIQ, I'll just point out, is very concerned about privacy and device user privacy, and all of the analysis that I'm going to present today and the work that we've been doing is approved sort of through an IRB review. So just to give you a sense of the representativeness of these data, you might be questioning when you see analyses showing up and around and about who are these device users, where are they coming from, how large is the actual sample. So the sample has about 100 million different devices, and that accounts for maybe, a quarter to a third maybe of the devices in the US. It's not a complete sample, but as you can see in this plot here, it's pretty representative in terms of the cities that it's drawing devices from. So there's a pretty strong correlation between the log number of devices in a given city in the smartphone data with the population of a city. Demographically, it's also pretty representative. If we look at the residential locations, the residential block groups where these devices are being drawn from, we see, for example, on the top left, perhaps where the data does worst, that about 7% of the devices are being drawn from block groups that are in the lowest decile of population density. So the data isn't really pulling rural areas as much as other areas. It tends to oversample slightly lower income households, minority households, and high school educated households, just slightly, but pretty much it's pretty representative. So when you're looking at these data, you are getting a sense of sort of the whole US population. In terms of the data we're using, where we're really focusing on retail visits, all of the types of retail chains that you think of as being sort of your big American retail chains are represented. So in terms of the most visited chains, you have your McDonald's, Starbucks, Burger King. For restaurants, then retail, you have your Walmart, Walgreens, Dollar General, etc. So it's capturing sort of a pretty wide range, in particular, of different types of retail establishments. We're not just thinking about department stores here. We're really thinking about all of the different places that Americans go out to spend money, interact with people, including gyms, gas stations, grocery stores, and banks. Bringing those two together, sort of where do people live and where are they going? The data is also fairly representative in terms of capturing what we see in national survey data of the lengths of trips that US households take. So in red and pink, you see that the smartphone data matches pretty well the distribution of trip lengths in kilometres, with the National Household Travel Survey in high population density areas. And in blue, you see the difference in low population density areas, where in those areas people travel longer, but the smartphone data is picking up those trip lengths as well. So that's sort of a brief overview of the data. And then, so what are we doing with it? So my co-authors and I have been working with this data for quite a long time to answer questions about the consumption value of cities and the interactions that cities afford households. And then when COVID emerged in March, we sort of flipped the switch a bit in our research in order to produce indexes that might be useful for policy-driven research related to COVID-19. So thus far, we've created two indexes that are publicly available. The first is a location-to-location matrix. So this is similar to the data that Diego was using to show that a lot of people that you're seeing higher positive testing rates in locations that were sort of the weekender spots to Madrid. So in this matrix, what we're showing is the exposure of a given county to another county. And we're specifically looking at the share of devices that ping in a county on a given day that also pinged in another county in the previous 14 days. So this is capturing sort of to what extent is county A exposed to whatever COVID positive testing rate potentially is in county B. The second index that we've created is a device exposure index, which is more focused on the exposure of individual devices based on their day-to-day activity versus sort of their longer trips that they're taking. And so what we've done here is we're effectively trying to measure the average exposure of devices that from the other devices that they come across or who are also frequenting the commercial venues, the retail establishments that they're going to. So specifically, we count the number of distinct devices that visited any of the commercial venues that a given device also visited in a day. So if I go to a Starbucks to pick up a coffee and there were 100 other devices that visited that Starbucks in that day, then that adds 100 devices to my device exposure index. We then average that across all the devices in a given county to get a sense of the average exposure of the devices in a county. So that's what I'm going to focus on in terms of the discussion today. So this fairly fast-moving plot is showing you how that device exposure really shut down from February through to April and then reopened again coming into May. So you can see here the median and then the interquartile range of this device exposure index over time. You can see that in sort of more regular times in February and into early March, we were seeing on average a device exposure index of around 1 to 200. And then that dropped down to about 50 pretty swiftly through the early to mid-March, and has remained around 50 since then. So there are two things to note here. First, you see this big drop in the device exposure index. And the second is the compression of that interquartile range. And so this I find interesting because it's that wide dispersion in the amount of interactions that we're having that across locations that effectively is telling us that locations are differentiated in terms of the amount of interactions and activity that you get, say, in a very densely populated urban location versus a less densely populated rural location. And we can see that through March into April and May, sort of the experience, the level of interaction that people were having became much more similar across locations, and cities in particular became less distinct in terms of the lifestyles they were affording people once people stopped going out to consume. So this sort of brings us to where we currently are, where sort of life in cities in terms of interactive consumption looks fairly similar to life in other places. And now, let's think about, do we think an urban activity will return? And then if it's not going to return fully, how is this going to change the benefits of cities in terms of being these consumer cities, consumption locations? So one thing to think about in terms of will activity return or not is thinking about to what extent is it the lockdown policies that are preventing people from going out? To what extent are they a constraint versus are they just in place and it's more a social norm that's developed? And so once the lockdown policies are removed, people will continue to not go out. So we can then analyze this to see whether these policies were a constraint, in particular by looking at when they were put into place, how did activity change? So here we have Philadelphia County, where I teach at least. I live in a county next door and out in the suburbs. And you see that the lockdown policies of businesses closing and the shelter in place order that happened in sort of mid to late April were not the catalysts for the reduction in activity. The catalyst came at least at the point of the state of emergency, where perhaps there was that information of the risk of going outside and interacting. And so in Philadelphia, you had your device exposure dropping by, to about a quarter of its original level after that state of emergency. More broadly, we can run an event study to look at essentially the coincidence of these policies with the drops in exposure. And you see that more broadly across cities or across all counties in the US, the state of emergency happened typically before the drop. The drop in this activity was coincident with the shelter in place orders and the non-essential business closure orders, which typically happened at the same time. Less so with school closures. Obviously, these events are potentially correlated with the social norms already. So one way to control for that is by using cross-state variation in the policies themselves and looking within commuting zones under the assumption that the social norms and the changing trends in social norms were shared by counties on either side of a state border that share the same commuting zone. So here I'm thinking about, say, people who live in Camden versus people who live in Philadelphia County, and the lockdown occurred earlier in Philadelphia versus Camden, but we were all sharing the same sense of fear in terms of going out. And once you control for this, for these commuting zone trends, you do see that the shelter in place orders did have some effect, and potentially the non-business closures did have some effect, at least in the short term. So that's indicating that there was some role played by the lockdown policies in shutting down activity. But now that activity is shut down, are we into a mode of lockdown and a social norm of not going out and not seeking these interactions, such that once businesses are reopened and the shelter in place ends, we still won't go out. And so let's take this example of Atlanta, Georgia, which was one of the sort of the earliest states to reopen. And you see it around this business reopening and date and shelter in place ending date. You don't see that much of an increase, really, at least in that county, of the device exposure index. If we look across all different counties or states that have relieved their shelter in place orders, again, looking within commuting zones, you see some upward trend in activity after the date that non-essential businesses were allowed to reopen, but it's very noisy. And you might think that this noise is created by sort of the Atlanta example of people not going out. But what is interesting is I think the noise is equally created by examples such as Philadelphia County, where we saw a big spike in people going out again. We saw the DEX was originally to around 200, it dropped to around 50, and it's jumped up now to have an average around 100 again, to be half of its original level. Even without any shelter in place being removed. Essential businesses, non-essential businesses haven't reopened in Philadelphia County, yet people are going out again. So there are sort of these social norms moving in both directions, meaning that we're not necessarily, that we could be potentially more optimistic depending on your view in terms of people wanting to get out, at least once it's safe, and once they perceive it to be safe, or people not wanting to go out. So, so this leaves us with the question of if activity does remain muted, at least to some extent, how will cities change? So a lot of my work over the past 10 or so years has been thinking about differences in the experience of cities and the draw of cities to high and low income households, the college educated versus the non-college educated. And particularly, I've been studying why have the college educated been moving back to US cities, to downtowns. And so looking at these differences in the experience of cities, right, we see, confirming the work that Victor Couture and I have, that indeed, here we have high income households do have higher device exposure indexes in normal times. They're experiencing more interactions. They're going to the SoulCycle spinning class and coming across, a number of other devices in all of these services that they're partaking in. Once COVID hit, that all stopped. So life changed in terms of device exposure or interactions more for the high income than for the low income, who started off with a lower degree of level of interactions. And here you saw sort of, even if there hasn't been a democratization in terms of income levels and of health, in terms of sort of day-to-day lives of most people, and the number of devices people are coming into contact with, that has pretty much equalized. So this is Philadelphia County. Here we have the college educated versus non-college educated. We're looking at the top devices that are coming from the most college educated census block groups versus the least college educated census block groups. And here is where you start seeing those essential workers who are coming from the non-college educated group are actually continuing to go out and put themselves at risk, where the college educated households are, they're not going to SoulCycle anymore, to their spin classes, and they don't have to go to work. They can work from home. So in terms of looking forward, this would tend to indicate that you're going to have those highly educated households potentially staying home more, perhaps not being as attracted to the consumption externalities of cities. But then when we had, in Philadelphia at least, the spike in activity, the spike is being driven by those higher income college educated households. So there's still an open question there. And then finally, thinking across cities in terms of which cities are going to change the most versus others, I think there's going to be some difference. This is looking again at that Dingle and Neiman work at home measure, you can see CBSAs where more work can be done at home had a larger drop in their device exposure than CBSAs where less work that can be done at home. So you have New York over here and the Villages, Florida, where you have a lot of essential workers going to those nursing homes up in the top left here. So I think it's going to be those cities that have a lot of tech jobs, for example, perhaps finance jobs that can be done from home versus perhaps eds and meds. Those cities, you might see people remaining in cities in the near term. Just to sum up, COVID-19 has drastically reduced the amount of interactive consumption that's taking place across US counties and really brought the amount of interactive consumption in cities to be more aligned with the amount of interactive consumption in perhaps more rural areas. The reduction is associated with policy constraints, but there's some indication that social norms are playing a large role as well. And if these norms or the policies persist, the recent influx of high income and college educated households might reverse, and particularly in centres for industries that are more remote friendly. So I encourage anyone who's interested in doing research or using these indexes to pull them from our GitHub. So thanks very much.